Assalamualaikum, my name is Mifzal, I'm from HK1. Today, I'll be presenting on family pedigree and inherited traits. So, a family pedigree represents one family tree by using symbols and lines that indicate a patient's genetic family history. It visually documents biological relationships in a family by showing the relationship of individuals within a family and pinpoint which individual have a particular trait or disease. In a family pedigree of at least 3 generations, it can determine how a particular trait is inherited. The techniques to draw a family pedigree are standardized so that everyone can look at the pedigree, then interpret and understand it. Thus, a standard set of symbols has been established for using in creating family pedigrees. After interviews and gathering information from 7 family members aged from 39 to 71, the most repeated and identified disease is familial hypercholesterolemia. Thus, it is the chosen disorder for this assignment. So, familial hypercholesterolemia is an inherited disease whereby there is a very high level of LDL, that stands for low density lipoprotein, cholesterol in the bloodstream. A person with familial hypercholesterolemia is unable to eliminate the excess cholesterol, causing a buildup in the blood. With a mutation in LDLR, APOB, PCSK9 gene, we have inherited pattern of autosomal dominant, whereby one copy of allele with mutated gene is enough to cause the disorder. In contrast, LDLRAP1 gene mutation will cause the disease to have inherited patterns of autosomal recessive, which is a person must have 2 mutated copies of the gene to be affected. Since both autosomal dominant and recessive are possible, thus, in this assignment, I will prove why my family inherited familial hypercholesterolemia is the autosomal dominant pattern. Now, with the data obtained from interview, we put all those data into one family pedigree. Now, from this family pedigree, we can see that the disease is distributed equally among sexes. Thus, the disease is not X-linked or Y-linked. Now, we know that the inheritance pattern of the disease is autosomal, but there are still 2 possibilities, which are autosomal recessive and autosomal dominant. We can observe that the disease is common in the pedigree and present in the 1st generation to the 4th generation, indicating that the disease does not skip generation. Every affected person in the family pedigree has one affected parent. Moreover, the disease is transmitted to almost half of the next generation. This aligns with the autosomal dominant disease characteristic of having half the chances transmitting the disease to offspring. Therefore, it can be concluded that my family's familial hypercholesterolemia is an autosomal dominant disease. So, why family pedigree is important? A family pedigree is utilized by health professionals as a diagnosis to guide decisions about genetic testing for patient and family members that are at risk. When a family is affected by a disease, an accurate family pedigree is required to identify the pattern of transmission. Besides that, a family pedigree also can identify other potential health problems such as diabetes and heart disease that an individual may be at risk because the probability of transmission of disease can be approximated. The benefits of family pedigree is to inform diagnosis. With the knowledge of family pedigree, faster diagnosis, efficient testing, and a better long-term management can be carried out. Secondly, promote risk assessment. A family pedigree information combined with other medical risk factors can estimate a patient's chances of developing a specific condition, classifying the risks into higher or lower categories. Third, to detect, prevent, and manage the disease. By referring to a patient risk, a healthcare professional can suggest suitable screening or intervention to help and improve the patient's health. In conclusion, I have learned and applied the skills required in constructing a family pedigree, which includes interviewing family members, understanding the symbols and drawing a family pedigree diagram. Moreover, I have learned to analyze a family pedigree, to differentiate and determine its type of inheritance. As a result, I have concluded that my family inherited disease of familial hypercholesterolemia is an autosomal dominant inheritance pattern. Lastly, I also realized the importance and benefits of a family pedigree.